All right, it's looking like we're populating the waiting room just fine. I'd like to welcome everyone to the Vasculitis Foundation webinar today. We're going to get started in just a minute. My name is Kathy Olewski. I'm the host for the Vasculitis Foundation Educational Webinar Series, and I'm also a patient living with MPA vasculitis. And today's webinar topic is what makes a strong disability application. And we are super excited to have Jodi Hall from the Vasculitis Foundation with us today to educate us and answer some questions. Let me begin by introducing Jodi. This is Jodi Hall. She is the Patient Support Coordinator for the Vasculitis Foundation and was a disability examiner handling Social Security disability claims for 2 years. So we're so lucky to have her here to answer our questions today. Welcome, Jodi.
Hi, lovely to be here.
And it's nice to see everyone else that's in the Zoom room with us. And what I'm going to do is ask Jodi to share her screen now so that she can educate us about disability applications.
All right. Everybody can see okay?
We can. Perfect.
Perfect. Okay. I am so excited to be doing this. My name, like Kathy said, is Jodi. I will have my email on the last slide, and we'll be posting this to our website. So if this is a lot of information, so if anybody has any questions at all, I am absolutely available by email or phone number. I have both on the last slide. So I just wanted to start by saying that. Like, if you have any questions that we can't get to in this webinar, I am always available. Okay, so what makes a strong application? And we're starting from the very beginning. So onset is something that the government looks at when they're determining what medical records to order. Now, this will be after you have already applied, and you can apply for disability online, or you can go to your local Social Security Administration field office and you can fill out the preliminary paperwork with an agent there. Either is available. Online is a lot easier just because you don't have to wait in those lines. You can usually submit it in the same day. But what you will need when you're applying online is a list of providers, so your doctors that you see for your impairments, the list of medications that you take along with any kind of side effects that those medications give you. And most importantly, you'll need your onset, which is the date that your disability began. So if you are diagnosed with vasculitis on a certain day and a month later you stopped working, your date that you stopped working would be your onset. And that is when the disability examiner will be ordering your records from. They typically order a year from your onset. So if you became so sick that you stopped working on February 1st, they would order records February 1st, the year before, into the current time frame. So it's super important to know when you stopped working due to your disability. And I thought it would be helpful to go over what a disability examiner is looking at when they are reviewing your application. So they will first look, are you performing substantial gainful activity? Now, to the federal government, this means you are making over $1,200 a month, which is not a lot. So when your vasculitis prevented you from making that or less, that is when your disability began. So you can be working part-time and just making less than $1,200 a month, and that would still be SGA, or less than SGA to the government. And then the examiner will be looking for, do you have a medically determinable impairment? This means that your vasculitis has been diagnosed by a doctor and that there's labs, imaging, any kind of medical workup to back up your doctor's diagnosis. So those pulmonary function tests, CTs, blood work, any of that works just fine. And then they will be looking at, is this impairment severe? And severe means, does it more than minimally affect your functioning? And if it is affecting your functioning to the point that you can't work, yes, of course, it's severe. And then if your impairment, does it meet a medical listing? So the Social Security Administration has some predetermined diagnosis where if you meet it along with a couple other criteria points, then you automatically get disability. There is a systemic vasculitis point where if it involves more than one body system, you could be eligible. But there are also several other body systems that you're eligible to get disability under, and I'll go through those here in a moment. And then the fifth one is if you can't return the jobs you have done in the past, can you adjust to new work? And this is where it gets a little bit tricky and where your work history will come into play, and I will get to that in the following slides. Okay, so first off, are you working to where you're making more than $1,200 a month? If you are not, then so if you are, then unfortunately, like you couldn't qualify for disability. If you're not, then the examiner would see that and say, okay, then we can move on to step 2. Step 2 is if you are having, if like I said before, your provider has diagnosed you with vasculitis and any type of vasculitis, and if you have signs and symptoms and imaging to back that up. So if by this point, yes, you do have an MDI. And then at this point, you'll be receiving paperwork in the mail, and the paperwork will have what's called an activities of daily living form, and it'll ask you things that you do every day, and you will be describing how your vasculitis impacts this. And then you'll also get a work history form, both of which I will talk about in more detail. So when you get your forms, your examiner is making a case for an allowance or denial. So you will need to be very thorough on how you're explaining your symptoms in your forms so that you can be sure that the disability examiner knows just how limited you are by your vasculitis. So if you have severe fatigue and making yourself dinner exhausts you, like you really want to mention that, the first form will ask, like the very first question asks you, like, what are your symptoms? So this is the time to say, I get terrible shortness of breath when I get up in the morning. I can no longer vacuum my own living room because I am so fatigued. If you are having like really bad neuropathy in your hands, you can say, my sister helped me fill out the forms because grasping a pen is becoming like too difficult for me. So this is the point where you really need to talk about your symptoms, because when your disability examiner is making the case for or against you, if they see that you're in your medical records, like, oh yes, this person was diagnosed with EGPA, and they're reporting like symptoms, like some respiratory involvement, and they're having shortness of breath walking up the stairs, then that disability examiner will more than likely not send you back if you've had work in the past as a contractor. They're not going to be like, well, this person can't go back to that job because look, they're experiencing difficulty climbing up the stairs. And so right. So some more examples. If you're using a motorized car at the grocery store, that's another thing that examiners look at, like how are you going about your daily tasks? How severe is your fatigue affecting you? Like if you can't hold a pen. Another thing is if you have switched from cooking to just like microwavable meals, that's another really big thing that people look for when they measure fatigue levels. And then this PowerPoint will be available on our website after I'm done, just in case you're taking notes or you want to go through it again. And then another really important thing is if your diagnosis of vasculitis has started or exacerbated any existing mental health impairments, that can also be considered. So like if you've been doing infusions or you're on prednisone and you're getting PTSD from like the symptoms and like just or if you've had surgeries and if you've been in long hospital stays, you can absolutely add that to your, like they will conjoin them to establish severity. Like if your depression has gotten worse, then you can mention that as well. So definitely don't leave out any mental health impairment, because that can also help the examiner determine just like how much you are dealing with. And so if your impairment is registered as severe, then you can move on, then the examiner will move on to determining which body system you will fall into categorically. There is an immunodeficiency or an autoimmune body system, and that's where the systemic vasculitis is under. But if you don't have all the criteria to meet that listing, then you can qualify under a different body system. For example, body system 1 is the musculoskeletal system. And if your vasculitis affects a major weight-bearing joint, or if you have a compromised nerve root in your spine, if you have a non-healing fracture, if you've had an amputation, if you've had a soft tissue injury that's under surgical management, you could very well meet a listing in this system, in this body system as well. So even if you go and see, oh, like I don't have two body systems intact, like affected by vasculitis, but like I have a non-healing fracture, or I have ulcers on my feet that aren't healing, then you could definitely meet a listing under this category as well. Body system 2, that is going to, and then, so in order to be disabled by the government standards, it will need the impairment will need to last at least 12 months. And vasculitis being a chronic illness, that the doctor will be able to establish that, yes, it will last longer than 12 months. Also, something really important for the musculoskeletal system, if you have been prescribed a wheelchair or cane or crutches for ambulating, then that is another very crucial thing to list in your activities of daily living form. Like if you are needing to use like a walker to get around your home, then that would be what's called inability to ambulate effectively. And that can really help your case moving along, because in a lot of jobs, like including office jobs, like a lot of people getting around with a wheelchair or crutches just isn't realistic. Body system 2 is special senses. So this, if your vasculitis is affecting your eyes or your ears, you could be considered under this body system. If you have tinnitus and it's making it really hard to understand people when they talk, if you are losing your visual acuity, or if your visual fields aren't what they used to be, then this could very well be a body system that you'd qualify under. Body system 3, the respiratory system. So if your vasculitis causes chronic pulmonary hypertension or has caused respiratory failure, any kind of obstruction in the way you are breathing, you may qualify under this system. This is where, if you've had pulmonary function tests, they can be really helpful in determining severity. And then with this one, a lot of examiners, when they are trying to establish how severe your pulmonary function is restricted, they will be looking to see if you are talking about shortness of breath and chest pain in your activities of daily living form. So if you are applying for Social Security disability and you have lung involvement, and I would really mention how much shortness of breath and chest pain affects your day-to-day life, because that's something that an examiner will take very seriously. Body system 4, that's your cardiovascular system. So if you have any kind of cardio involvement, and this kind of like the pulmonary systems, if you are experiencing chest pain and shortness of breath, another really 2 huge symptoms to mention. Also, in this body system, if your doctor has said, like, I don't feel comfortable with you participating in exercise testing, that's huge. If you can't participate in exercise testing, there's not a great chance that you're gonna be able to hold down a job in the workforce, just because of how limited you would be. So definitely mention if your doctor has told you that you're not able to perform an exercise test. And then the digestive system, if you've had extreme weight loss due to your vasculitis or due to a medication, like if you're prescribed a medication and the side effects of the medication that you've been prescribed is affecting your life and it has affected your ability to maintain your weight, if you have a BMI under 18.5, you could be eligible in this body system. It is, so again, like if a medication has really limited your appetite. Body system 6, kidney disease. If you have chronic kidney disease and you're on dialysis, then that you would meet a listing in that body system, just because you're not expected to hold down a full-time job if you're needing to be on dialysis. If you've had any complications with blood clotting, that's resulted in hospitalizations within a 12-month period, you could be body system 7. If you have vasculitis that causes skin problems and you've had ulcers with lesions and that persist even with treatment, you could qualify under the skin listing disorders. And then neurological disorders, if your vasculitis has caused loss of sensation, if you're getting muscle weakness, forgetfulness, confusion, you could qualify under body system 11. And this is the one where also, if you are experiencing neurological involvement, having like a loved one, like any kind of care partner, help you fill out your forms can really show the disability examiner that you're needing help, because like you can't work an office job if you're having fine motor skill involvement. So that's a really huge one to just say that I'm really needing help organizing my thoughts. I'm really needing help writing things down, like being able to like organize how I am like thinking through information. Body system 12, like I mentioned before, if you have any kind of mental health disorder that is new since your diagnosis or that's been exacerbated since your diagnosis, absolutely mention this. If you have difficulty understanding, remembering, or applying information, if you have trouble with sleep, restlessness, racing thoughts, depressed mood, then that is crucial to your daily life, and the disability examiner should know about it. And then the last one we're going to talk about, body system 14, that's your immune system. This is the only body system that vasculitis is named under. Of course, that does not mean this is the only system you can qualify under. As I mentioned before, you can qualify under any other system. This is just the only one that mentions vasculitis by name. And you can meet this listing if your vasculitis involves more than 2 body systems or organs, one involvement being of at least moderate severity, and if you have 1 or more constitutional symptoms, and those are severe fatigue, fever, weight loss. And then this is why it's crucial that you're listing your symptoms in your forms, because a lot of what qualifies you to meet what a medical listing is are symptoms that you yourself report. So it's crucial that they have that documentation. And then you can also meet this listing if you've suffered manifestations of systemic vasculitis and 2 of the symptoms that seriously limit your activities of daily living. So again, that's why you really need to be listing that in your forms. So at this point, the disability examiner, if you do meet a medical listing, you will be allowed right away. It is really hard to meet a medical listing just because you have to have like a very certain amount of diagnosis backed with a very certain amount of testing that backs that up. Like you have to have like this on your pulmonary function test. You have to have this ejection fraction. But where most people get allowed is considering your past work history. So even if you have a severe medical condition, just because it doesn't meet a listing doesn't mean that you won't get allowed, because when you consider your past work history, this is where you can get allowed because you can't return to work you've done in the past. So in your work history forms, you will write what jobs you have done in the last 25 years. And you really have to be thorough with what you're writing down. Like even so let's say you were a carpet cleaner, and mostly you clean carpets using a machine that you would just push, but sometimes you had to get down on your hands and knees and scrub. So even if that only happened like 5 minutes every day, like you would want to list that, because like that's because if they say that like, yeah, they can't do carpet, or they can go back to doing carpet cleaner because they don't have to use their fingers. Well, like you do, because you had to, at least for 5 minutes a day, use your fingers to scrub the carpet. So that's why it's important to really be thorough in how you're listing your past work, so that they know that they cannot send you back to a job that you've done in the past if you can't do it. So your examiner will be listing your past work. They'll be rating each job sedentary, light, heavy, or very heavy. So those very heavy jobs, like you're listing 50 pounds, you're on your feet 8 hours a day, like you're doing like kind of like construction work. Sedentary is like office work. So if you have done like all very heavy like construction work, and you are and then the examiner looks at your profile and says, wow, this person has a lot of problems breathing, they're having a lot of shortness of breath, like I can't send them back to very heavy work. So I'm going to limit them at sedentary work. And because you are limited to sedentary work and your past work was rated very heavy, then you would be allowed because you couldn't return to past work. And then that is what I'm saying here. If after the transferable skill assessment meeting, I've rated you sedentary and you've done hard, heavy work, so you can't go back, this is where most claims are allowed. And again, so just some helpful things to know. Examiners are required to address every allegation you make. So if you are saying, if your prednisone gives you racing thoughts and it makes you agitated, you like mention that, because I need to take that seriously. And if you are getting, if like I said before, if you have anxiety or depression, absolutely mention that as well. What could happen if you have anxiety or depression symptoms, but you've never seen a psychiatrist and you don't have an actual diagnosis, then the state or the state you apply in can send you to get a free exam where a doctor can review your symptoms and meet with you and talk about it, and then they could then diagnose you with depression or anxiety. So just because, and that's all for free, but just because you don't have an actual like diagnosis from a psychiatrist doesn't mean that you can't allege one, because it could very well be that you have a disorder. And then another really crucial component is medical source opinions. So if your doctor has said in his or her medical records, yeah, this patient, I do not feel like they can work 40 hours a week. Or if they say, I don't think they can lift more than 10 pounds. Or if they say like their fine motor skills are very impacted, I don't think that they could hold down an office job, then that is not another thing that a disability examiner will be required to review. So they would have to make a really strong case if they're going against what a doctor has said. So medical source opinions are a huge asset if you can get one from your rheumatologist or a treating physician. And like I said, if you have any questions, that's my work email, that's my phone number. Please feel free to call me or email me, and I'd be happy to answer any more individualized questions you have, or if you'd like me to walk through paperwork with you, I'd be more than happy to do that as well.
Well, thank you, Jodi. We appreciate all that. You can stop as soon as everybody has a minute to write this down. If they're going to write it down, we'll let you stop sharing your screen so that we can see you a little bit larger on the screen in just a second. I did want to say how incredibly helpful all of this information just to me, like I'm so surprised to learn most of what you just told me just now. So yeah, so I'm sure there'll be plenty of questions. Okay, I think it's safe for you to stop sharing. Okay. So, and I'm going to start with some of the questions that were submitted in advance, but we do have one question that so far has been submitted, so we'll get to that in just a minute. To start out, one of the first questions was, is each EGPA considered a disability, or is it the symptoms or involvement of the disease that they measure for the disability? And that kind of goes for all forms of vasculitis. It's the same kind of question.
Right. So even though EGPA, GPA, even though they aren't like listed verbatim in the disability or in the Social Security Administration's medical listings list, you can still be absolutely allowed, and that's not a problem. You can be met under the disability or under the vasculitis listing itself, but like I mentioned before, you could also meet under the pulmonary listing or cardio listing, skin listing. Like there are ways that you can get an allowance without having one of those listings. Just because EGPA isn't verbatimly written on there, then that won't stop you from getting an allowance.
Okay. And, since you said what you said, it just makes me wonder, is it helpful? I mean, you did tell us to list everything that we can, but if we have, say, EGPA and we have lung involvement, or in my case, MPA, and I have kidney involvement, it's good to list as many of those things as possible, apparently.
Absolutely. Like if when you are when you list the conditions that you that you're applying for, you can list like MPA with renal involvement, or you can list EGPA with lung involvement, and then that's absolutely fine. The examiner, even if you don't, the examiner will look through your medical records and see that there is kidney or lung involvement, but yeah, you can absolutely list that.
So this is maybe a little bit different of a question. If you apply for this online, I understand that if you're sitting in front of somebody, there's communication back and forth. But if you apply for it online, how do you have communication with the examiner?
You will get when you apply online, you will get a stack of paperwork in the mail. Unfortunately, it's all delivered by mail just because they're really paranoid of something getting hacked or through email. So all of the paperwork that you receive will be by mail. So you'll receive your activities of daily living form in the mail, your work history form in the mail, and then you'll receive a letter stating your, they're either called disability examiners or disability determination or counselors, and you'll get their phone number on that paper.
Okay. And can you apply for disability if you're a full-time college student? I thought that was an interesting question.
So there is no law saying that you can't. However, it would be hard because a lot of what you do in college are kind of like work-based activities. Like you have those computer skills that you're learning. So you're doing kind of a lot of office work type activities. So the disability examiner could make the case that because you're doing this full time, you could adjust to working full time. So there's no law against it. You would be considered, but I do think it would be hard to get an allowance.
This question that came in today is along the same lines. It says, what if I was told I had this in GPA at 12 years old and jobs were limited due to the GPA, but was a teen and in my young 20s?
Okay. Then I would apply for benefits and I would list your onset date. If your jobs were making less than $1,200 a month, then I would list the onset date to pass that. If you were making more than that, then I would list the onset date to whenever you stopped making that much money a month. You sometimes can get back pay, so I would definitely apply. I don't know that part-time. I don't know if you're making less than $1,200 a month, then I would absolutely apply with an onset date of however young you were.
Interesting. Okay, next question. How is undue hardship on an employer measured when employers deny reasonable accommodations?
Oh, I'm sorry. I didn't do my work was only with Social Security Administration, so I didn't do any employer law.
So we don't know that one.
I do not know. I'm sorry.
Okay, the next one is this was one of mine. Can you apply for disability when you're on Medicare?
Yeah. You can't, and when you get SSDI, if you're applying for Title II disability, meaning that you have worked enough to earn work credits to apply for SSDI, then in most states, you will get Medicare right along with it. So if you're already on Medicare, then yes, you can apply. If you're getting retirement benefits, then you can't. But most people with SSDI will also get Medicare.
Okay. And if you're denied disability, can you appeal it? And if you do you need to change something so that you won't be denied a second time?
So if you are denied and you want to appeal, that is completely your right. And you can't go back and change anything in your initial application. But what you can do is submit new evidence. So if you were denied because they thought your prognosis was positive and you were responding well to treatments, well, if you start not responding very well to treatments, or if you're getting more symptoms from your medication, then you can appeal and submit new medical record evidence. So, and then by me saying medical record evidence, I mean you can list the where you were treated and the dates, because you're never required to get your own medical records. That's something that the government will do for you. You just need to list where and when and by whom you were seen, and then they'll get the records. But like if you want to appeal your denial, you can, and then you can submit, I've seen Dr. Murphy since then, and this happened, and they will get the records and see that your condition is worsened and you could be allowed. So you always have the right to appeal.
Okay. Here's a question that came in today. So I'm a triad patient, and GPA does affect all three systems, upper and lower respiratory and kidney involvement. If I'm to understand this correctly, since there are more than two systems involved, the likelihood of me getting approved has gone up in the chances of approval simply because of that, provided the paperwork is all up to snuff. That's correct? So if they have three systems?
Yeah, just if as long as one of them is at least moderately severe. And then, so that's a pretty subjective term, unfortunately, but to a lot of people, like, it just means that you have, like, whichever body system is affected, you're having like some pretty significant symptoms. So like respiratory, that you're having some pretty significant shortness of breath, like you're needing, like, you have to take a break after every stair you go up. Like, after vacuuming your living room, you're getting, like, you need to sit down for like 10 minutes. So as long as at least one body system is moderately severe impacted, then yes, you would have a good chance.
Okay. If you're denied disability, do they give you the reason why?
Nope. No, they just they send out the same letter to everyone. They just say, due to our findings from, and then they'll list your providers and our own analysis, like, you didn't meet the qualifications. Unfortunately, they don't tell you exactly why you were denied.
That's interesting.
Yeah, I know.
So in terms of the work for the past 12 months, if I've been on short-term disability for 9 months, but working before that, will they go back to the 12 months while I was working?
So if you weren't working during those 9 months that you were on short-term disability, they would go back to when you started short-term disability 12 months after that.
Okay. I had a question that I thought of when you were doing your presentation. It was, you were talking about the body system 6, and that if you lost weight, that was something that you should tell them. What if you gain weight? Like, everybody on prednisone, like, some of us gain 50 pounds. Is that something to bring up also? It won't meet a listing, but if you have gained weight, then that can be used towards the work analysis toward the end, when they're determining what jobs you can go to. Like, if you've gained a significant amount of weight, then they would have a harder time saying, oh, but then you can go do this like heavy lifting construction job, or you can do a job where you're on your feet for 8 hours. So it can limit you in a work capacity way. But there is currently not a listing you can meet where weight gain is a contributing factor. And how many times can you be denied an appeal? Is there like there's not
a limit.
So you can just keep appealing? Because I know some of the vasculitis social media groups, I've seen that people have been denied, and other people encourage them to appeal it because they sometimes got allowed on the second time. So that's not unusual. This is just plain old not knowing anything about disability claims, but I honestly did not know you had to already not be working to claim disability. I guess in my mind, I thought if I could get disability, I could stop working, or that's what I've talked to other people who thought that. So you definitely have to be not working for a period of time in order to try to achieve disability.
Yeah, unfortunately, because in the government's eyes, if you're making more than $1,200 dollars a month, then you're not disabled, which is something I don't agree with, and it's a very grueling process. But yeah, you have to be completely unable to work to be disabled under the Social Security Administration.
And then this question came up: if you're approved, do you have to keep reapplying to keep your disability?
That's a great question. So if you are approved, then you will be given what's called a diary. And the diary length can go from 1 year to 7 years. And if you are approved a 1 year diary, then you'll be given benefits for 1 year and you'll have to reapply. There's also a 3 year. So if it depends how severe your case is. So like if you have if you're like 60 and you have EGPA, they'll probably give you like a 7 year diary just because like of your age and the severity of your impairment. But if you have another form of vasculitis and you're in your 30s, they might just give you 1 year and then you'll have to reapply, and they'll see through your medical records if anything has changed or not. And you actually won't have to reapply. It'll just be like the examiner will review your case every year. So you're not responsible for reapplying. Your case will just be reviewed on an either 1, 3, or 7 year basis.
Okay. And then the person that asked the question earlier is saying, I'm still confused. Does the 12 months determination include the 9 months of not working while on short-term disability? I guess they're asking.
Yes.
Oh, it does. Okay.
It does. Yeah, because you're not working.
Okay. Hopefully that clears it up. So one of the things that I noticed that there's just a lot of questions surrounding disability in general and who can qualify for it and what age and everything. And it sounds like the younger you are with the less work history, the harder it might be to qualify.
Yeah.
So that's interesting. I didn't know that at all. And also the part about if you're earning over $1,200 a month, just, doing hardly anything, you won't qualify.
Right.
So, okay. Well, those are a couple interesting things. I'm looking to see. Oh, looks like one more came up. I know you mentioned gaining weight would not be a factor. However, would mentioning gaining weight, this person gained 45 pounds within a month of being on high dose prednisone. Would it possibly be a contributing factor if it created much worse joint pain that has prevented me from working? I was diagnosed with urticarial vasculitis and arthritis at the same time, and they go hand in hand from what my doctors have told me.
Right. So with this, you are like, yes, like they'll see in your medical records about the weight gain and how it's affecting your joints. And yes, like again, while you are not meeting a listing, they will in the vocational analysis be able to say, like, okay, this person is having a significant time, like they would have a really hard time walking along across if you worked in retail, they'd have a really hard time staying on their feet for 8 hours a shift. They'd have a really hard time walking up and down stairs, taking out the trash at the end of the shift. They'd have to step down a curb, and that would be really hard on their knees. So anytime like a weight-bearing joint is involved, and if you're experiencing more pressure on your weight-bearing joints, then you could still be allowed, absolutely, even though weight gain, you're not meeting a listing, you could still be allowed on the basis of like weight gain in conjunction with vasculitis, absolutely.
Jodi, I think you sort of addressed this, but I think I was thinking about it when you were talking about it. So if you are going through consideration for disability and you work a certain kind of job like retail, do they ever say, well, yes, you're not going to be able to work retail, but you could probably work some remote job sitting at home, and then they deny you?
Yeah, that's definitely, that can be a possibility. On step 5, that's when they say like, can you reasonably be adjusted or expected to to adjust to other work. So that is when relies a lot on your age, past work history and education. So like if you have like a master's degree and they limit you to sedentary work and you've only done like medium work and you have like a master's degree and you're like 40, then they can probably say, well, this person can be a receptionist. But if you're, again, like over the age of 55 is a really big point for the Social Security Administration. So if you're over the age of 55 and you don't have any kind of secretarial management, don't have like a bachelor's degree, then they could say, oh, this person probably can't reasonably adjust to new work outside of what they've done in the past. So there's a lot of vocational analysis involved at the end. But again, like if your vasculitis is severe, then I would still encourage you to apply.
Interesting. So somebody just asked, what about a PVT, disability insurance policy you have through work? Can you still apply for SSI? I don't even know what
means
PVT
private.
is.
Private.
Private.
I believe so. I don't think that there's any law saying if whatever private disability insurance is paying you over $1,200 a month, then probably not. But that's something that when you are applying, that the Social Security Administration field office would probably help you understand a little bit better. I was on the medical determination side, so I didn't handle a ton of the preliminary finances, but I don't see why you couldn't.
Okay. I think that's all of the questions. You did a great job answering so many of them. We appreciate it. And I'll remind everybody that Jodi has said that she is available. We have her through the Vasculitis Foundation, which is just wonderful. She's a patient outreach coordinator. I guess I got that right. I don't know, have my notes in front of me. I think that's great that you're accessible to us to ask these questions. It's interesting because this is one of the big topics that comes up periodically in a lot of the vasculitis social media groups. So those of you that have been watching today should let others know that they can watch the playback of this on the Vasculitis Foundation website when we get it loaded up there. It usually takes a week or so to get that done. But Jodi, we appreciate so much you coming on here and answering all these questions today. I was hanging on to see if there are any more, but everybody's just saying, great job, Jodi. Thank you so much for presenting.
Of course. Let me know if you guys have any individualized questions, anything you want me to go through. I would love to chat with you.
That's wonderful. Thank you so much. And
of course,
thank you to the Vasculitis Foundation for making these things possible for us. We appreciate the webinars that are the medical webinars that are done because of Vasculitis Foundation. And I remind everybody to go to vasculitisfoundation.org because that's where these webinars will sit after they've been edited and put up on the website. So thank you so much, everybody. We enjoyed our evening with you today.
Thank you, Kathy.
Thank you.
Thank you.